Angela Merkel doesn't want us to go anywhere because we're such a health risk, according to her. But it turns out that up to 5 million British holidaymakers could be barred from Europe because they were given the Indian-made version of the AstraZeneca jab. I mean, where did this come from? And how do you know if you've had the Indian version, the made in India jab? Let's talk to Dr. Bharat Pankania. He's senior clinical lecturer at the University of Exeter Medical School. Good evening, Bharat.
Hello, good evening, Kevin. Good
thank you. Thank you for joining us. Now, we'll get to the sort of chemical side of this debate in just a minute. But this has come from nowhere, these aspersions about the Indian-made AstraZeneca jab. But suppose there's something in this. Now, you know, people who've had the AstraZeneca jab have been given, I think, a little bit of cardboard to say you've had the AstraZeneca jab. I don't think they've been told where it was made. So if you say go to Germany or something and they say, well, where was your AstraZeneca jab made? Was it made in India? I don't think the average Brit is going to have any idea.
Well, if you look at your immunization card that you were given when you were immunized with the AstraZeneca Oxford vaccine, the batch numbers that are in reference to the ones made at the Serum Institute of India, they end in Z001, Z002, Z003. So those are the batch numbers for the
so there is a way of telling
ones made in India.
Yeah. So there is a way of telling. Fair enough. Well, that sorted that problem out. Is there any credence in the suggestion that the Indian-made version of the AstraZeneca jab isn't much cop?
No, not at all. This is an administrative issue in that the Serum Institute of India has to get clearance from the European Medicines Agency, and it is a question of applying and having that clearance. And in anticipation and to assist the European Medicines Agency, the MHRA, which is our United Kingdom regulatory body, has already supplied data and information and all the stuff that's required to gain clearance to the European Medicines Agency. So what this is exemplifying is an issue of having dotted all the I's and crossed all the T's, and all the paperwork and all the permissions are in place. And lo and behold, we find that the permissions for the Serum Institute of India manufacture with the European Medicines Agency was not in place.
So what's the situation? When will can this be sorted out fairly soon?
Of course it can be, and I really want to reassure our viewers and listeners that there is nothing whatsoever different between the Serum Institute of India AstraZeneca vaccine compared to the one that is made in the United Kingdom. It's exactly the same formula, exactly the same quality control. It is the same product made in another country.
Well, that's good to know. That's what I'd always assumed. So that's nice to know. What do you feel, Bharat, about Angela Merkel coming over here today to see Boris and urging Boris to stop Brits travelling to anywhere in Europe because she thinks we're a health risk? We're riddled with the Indian or Delta variant or whatever we're calling it right now. What do you think about that?
Remember, Kevin, we have the Delta variant outbreak in the United Kingdom because Prime Minister Johnson delayed putting India on the red list. We mustn't forget that. And then the rest is history with regard to the delayed removal of restrictions in the United Kingdom. Every prime minister, every leader of each country has to look after the interests of their own country. And what European Union, Angela Merkel for Germany, etc. do is they're working in their own personal country's interests. And that's the way it is. We would do similar things if we had similar concerns about other countries.
But suppose that I'm a UEFA official. Do you think that Angela Merkel might give me a VIP status? What do you think about the fact that Boris Johnson is allowing 2,500 UEFA officials to come to this country for the Euros final at Wembley with no questions asked, no COVID checks, no proof of vaccination, nothing whatsoever. They get a complete VIP pass. Is that a safe thing to do?
No, Kevin, I, as an infectious disease expert, would like to say absolutely clear. The virus does not recognize UEFA VIPs or any other VIP for that matter, or any other border. So it is ridiculous, absolutely ridiculous, to give them a blank check to say, come and go as you wish. Absolutely ridiculous, and it makes the work of infectious disease control management for people like myself who are trying to protect our nation that much more difficult.
And where are we now, Bharat, in terms of the COVID crisis, the pandemic in this country? I mean, we keep reading that the vaccination rollout is a triumph. 60–70% of the population are now vaccinated. Surely we must be at some sort of herd immunity. We're seeing cases rise, but death rates plummet to they're very low, which seems to indicate that the vaccine is triumphing and turning COVID into a sort of non-fatal condition. Is that a fair assessment of where we're at?
Well, the fair assessment would be as follows. The vaccines protect and the vaccines prevent you, by and large, from entering hospital with severe disease and on the ITU and dying. So the vaccines are working, and they're working very well. So we can now say that there is an uncoupling, meaning the cases are not resulting in hospitalizations and death. So there is that uncoupling between cases and hospitalizations and death. And that is entirely or mostly due to the success of the vaccines program. Now that we know that it works, and it works very well, we've got to immunize as many people as we can. And I young group as well.
Right. Can I just ask you one last question? Go slightly off piste, if you don't mind, Bharat. Have we lost him?
No, I'm still here.
Okay. It transpires that in February, we lost 1.6 million NHS working days because NHS staff were always having to go off and self-isolate because their NHS apps kept going off at work because they came into close contact with people with COVID. Well, in hospitals, you'd imagine there might be a few people with COVID. This is kind of absurd, isn't it?
Yes, Kevin. And
I think we're